think traditionally men have been maybe not really considered as like relevant to the conversation around things like eating disorders or body image, linking that back into even the classification of these types of issues. Additionally, I think there's a lot of sort of cultural baggage around, who gets an eating disorder and who doesn't, as well as what it means to say as a man that you're struggling with your body image or appearance. Looking at those cultural aspects of how people think about an eating disorder, really we've got these sort of templates in our mind around who fits that idea of like an eating disorder, who's sort of appropriate or inappropriate to have one. And men don't often fit into that sort of conceptualization that people have. So for example, many people might have an idea that men aren't even really supposed to care that much about sort of their body image or be as impacted as women by, for example, messages in the media around what an ideal body is supposed to look like. I actually don't often hear men saying things like, I should have come forward earlier, but it's typically more along the lines of someone might present with an issue around depression or anxiety, or they might describe, I'm having a lot of self-esteem issues. So a lot of the times it's actually more listening to someone and how they're describing what their sort of subjective experience might be of whatever they're dealing with, and then almost backtracking it over the course of a couple of conversations and saying, well, you might not have thought of it this way, but a lot of these issues that you're dealing with around your mood or self-esteem are actually linked back into your body. Where I think a lot of men struggle as well is the ideal notion of what an attractive man's body looks like doesn't necessarily fit with how people perceive what an eating disorder might look like. So as opposed to needing to be thinner or losing weight or restricting food, it's actually more about needing to be bigger and more defined in musculature. Muscle dysmorphic disorder is actually quite interesting when you think about issues around body image. So where this might share some things in common with an eating disorder is lots of issues around mood, self-esteem. It's certainly something that's linked back to the physical body, how someone's being sort of perceived by others. But really it actually fits into a spectrum of obsessive compulsive disorders, which has some pretty big implications in terms of how we might treat it. So the difference between like a body dysmorphic disorder or a muscle dysmorphic disorder and an eating disorder is it's less so about, needing to restrict eating to, get smaller or something like that. It's more about, I have a perceived deficiency about how other people might see me. So at least in men, a lot of the times it translates into muscle dysmorphic disorder in the sense of, I'm too small, I'm too weak, my muscles aren't big enough. I think in terms of the physical appearance piece, for men, not always, but I would say probably typically what I see is it's less about, stepping on the scale and having a certain weight, and it's more a focus on body shape as opposed to weight. So wanting to, be leaner, more defined, these types of things, which certainly we'll see that in women as well, but it doesn't seem to be as common where men are so focused on that restrictive eating sort of portion. Not suggesting this is always going to be sort of pathological, but for example, when people are talking about clean foods, right, versus the opposite of sort of dirty foods, right? That on an extreme level might sort of fit into that idea of orthorexia. So you may see someone who might appear like they're making super healthy decisions all the time by, for example, only eating, steamed broccoli and chicken all the time and eating it in excess and working out all the time. But really what might be behind that is lots of sort of mental suffering or social suffering. So it tends to be a little bit more difficult, I think, to identify amongst men when they're struggling with these types of issues, because others might perceive it as, no, that guy's super healthy, look how much he's working out, look at how he looks, look at what he eats. But really there's, what needs to be investigated is what's really behind those decisions, right? In the past, it may have been viewed that, okay, men who have issues with body image or self-esteem or eating issues sort of fit into these special groups. So, for example, certain types of athletes, wrestlers, for example, or this is a problem of the LGBTQ plus community. Really now it's like you can look anywhere and be bombarded with these messages, and they may be sort of wrapped in this idea of, okay, this is about health, this is about performance, this is about being stronger, but we're coupling that with this idea of, okay, this is what an ideal men's body should look like. So if someone's already dealing with issues around self-esteem or depression, or they don't like what they see when they look in the mirror, it sort of plants this seed of, oh, okay, now I have something that I could work towards and everything will get better, which is not necessarily going to be the case, right? I think that changing definition of idealized masculine beauty, that's important to look at. I think it's also important to look at what is being sort of portrayed by that. What are we tying up into that in terms of different values? So this is a body that you may look at and go, oh, well, this person's overweight, they must be unhealthy, they must be lazy, they must be all of these things that we might view as negative, where, seeing an image of a guy that is, ripped, oh yeah, he clearly works out all the time, he must be so productive in life, he must be so successful. Someone who is, let's say, working in a trade, there may be a high value placed on, strength and endurance and things like this. So if you have a body that just implies that, when you walk onto a job site, then, it's probably going to feel pretty good compared to if, you are somebody that, is maybe overweight or something. Similarly, looking at people that are working in areas like finance or, law, or maybe these more white collar types of professions, I think that plays out there as well. Do you want to be perceived as the guy at work that's lazy, or do you want to be perceived as the guy at work that's, tough and productive and putting in all those extra hours and things like that? When of course, these things don't necessarily translate at all, right? So, in terms of signs and things to pay attention to with sort of people around us, people that we care about, this one can be, I think, a bit tough, again, going back to men not necessarily always having behaviors that we might attribute to an eating disorder or something along those lines. But I think it's also difficult to sort of notice what might be going on, because we do have a lot of cultural messages that, someone who's working out excessively, using, supplements and really paying close attention to their diet, that's actually a healthy and positive thing. And I don't want to conflate people who are, looking after themselves and, doing these things that are quite healthy with some sort of issue. For example, if you've got a friend who all of a sudden is, not attending any sort of social events anymore because they're just constantly working out. Of course, any sort of significant changes in diet, how somebody's presenting sort of socially. These types of things are good to pay attention to, but might not necessarily be indicative of this type of issue. I think really noticing any of those types of changes or concerns, it's worth expressing, hey, I've got some concern about what might be going on. I would say stigma is one of the major barriers for men when it comes to actually seeking treatment. I think a lot of men may not even really identify that this is the issue for them in the first place. They may be focused more on, I'm experiencing a lot of anxiety, or I'm feeling like I don't really want to necessarily be around people because of, how I look. They may have a tendency to fixate more on the thing that we're told is a bit more appropriate to talk about. So again, coming in and saying, very anxious all of the time, or I'm dealing with social anxiety, as opposed to I have some serious concerns around, my body image or things along those lines. So I think another barrier to being able to sort of identify the need to seek help is, men not necessarily fitting some sort of mold or template people might have. Showing up at a doctor's office and, everything comes back fine on, blood work, all this kind of stuff, and the doctor is maybe looking at that individual and going, wow, this person's like the picture of health. With women, if things get to a certain point, people are maybe a little bit more likely to notice. So when a body weight gets low enough that it seems dangerous, or for someone experiencing, bulimia who's purging, it's easier for a dental hygienist or a dentist to pick up on that, or even, a partner or family member to, put sort of things together a little bit, whereas having someone in your life who seems, every time they're stressed, they go to the gym for 4 hours, you might not necessarily put that together as, this is a sign that there's something maybe a little bit more serious going on here. I think just in terms of trying to help somebody out, starting from that place of concern and trying not to move sort of too fast or too far ahead of, where you actually might be in terms of being able to have that conversation with someone you might be concerned about. So really just starting with, hey, I'm a little bit concerned about you. Could we maybe set up like a bit of time to talk about X? So maybe that's, you seem like you're a bit more like down lately, or, you seem like you're struggling a little bit. Sort of taking things slow, trying to get that opportunity to sit down with somebody sort of one-on-one privately, where you're not necessarily going to be interrupted, and just sort of voice some of the concerns in that gentle way. I'd suggest really asking a lot of questions and just sort of letting that person talk, as opposed to saying, it's this and here's exactly what we're going to do. Probably the most important thing if you have somebody starting to talk about these issues, and I think it cuts across gender lines completely, is you really don't want to put that person in a situation where they are feeling, for whatever reason, they want to withdraw from the relationship with you or that specific conversation. And again, really just sort of taking time and not trying to put too much pressure on or try to drag that person along too much. I think things get a little bit different when you start talking about relationships where maybe it might be a little bit more invited, I guess, for someone to be a little bit more directive around things. I also think that it's implied with, let's say professionals or coaches, that it is appropriate for them to sort of broach these types of topics. When it comes to parents, I don't know if it's really that I'd really give advice that would vary too much from what I might say to a peer. I think it would really depend on what type of relationship the parent has, with their kid. maybe not being afraid to say, hey, this is turning into a different type of conversation and we should probably get someone involved, like a psychologist or a psychiatrist or family doctor or social worker, somebody that's got some expertise and background in these types of issues. How I might identify these issues is, regardless of who I'm talking to and what issue they may have come in with, one of the key areas of focus in my intake process is always going to be around, someone's, sort of lived experience in their body and kind of what that's like for them. So that might focus in on questions around self-esteem and body image, but I also will always ask someone, what's, a typical, month look like in terms of, your eating patterns and behaviors. There's certain things that might give me a little bit more of a clue that there might be an issue, especially amongst men. So, for example, if I'm doing screening with a new person that I'm working with around substance use issues, I'll always ask around steroid use as well, for example, which I think might get overlooked sometimes. So I think for me, it's, again, not necessarily going in with any sort of preconceived notion when I start working with someone that, they're coming in for an anxiety issue and it's definitely going to just be anxiety that's going on. And I think most healthcare providers sort of take that sort of stance, starting to work with someone and really trying to get that more sort of holistic approach in intake. The most important thing that I'd want people to take away is any sort of template or idea that you might have in your head of what someone is like who has issues around their body or their relationship to food, to throw that out. There's not really like one type of person who's, maybe immune to these types of issues, or one type of person that is always going to have these types of issues. So I think the most important thing is to try to check those types of like preconceived notions and really just try and have conversations with people if you've got concerns around these things in ways that are not necessarily pushing someone too hard to the point that they shut down.